Maya is the first patient that we've enrolled here at UCSF for this clinical trial. She is carrying a fetus with Hunter syndrome, which is a disease that runs in families and in her family.
My baby brother, he also has Hunter syndrome. So it's been a lot of research in my family that we've looked over and looked into different treatments. I always have hope, because when we first got his diagnosis that he does have Hunter's, that I am a carrier, it was a very emotional time. We had our tears.
I wanted to give him a fighting chance because the previous year we had a miscarriage with twins, actually. So we were young, but we were still hurt, so we didn't know how to feel.
At first I was nervous. I'm not a fan of doctors in the hospital, but Dr. MacKenzie, she's great. It feels like a family. I'm hoping that these procedures and the enzyme replacement allows my son to say mama, daddy. My brother has not said mama, daddy, or sister.
These are, of course, rare genetic diseases, and it's even more rare to have a fetal diagnosis of this condition. But we feel fortunate that we have enrolled and treated now 2 patients, and we're hoping that as patients hear more about this clinical trial, that they will seek us out for more information about participating.